Alright, today I'm going to complain about this article, or some things in the article, but I feel like I need to give you some background because I think most of my viewers are not from Australia. So, in Australia, we do have, like, universal healthcare, and if you have, like, a medical emergency and end up in hospital, sure, that would be covered. But, if you have, like, a less urgent thing, quite often Medicare will cover a certain amount, but then beyond that, you have to pay it yourself. And so we also have like a private health system where, you know, you pay a premium and certain other things are covered. It's kind of complicated. Anyway, with psychology, like the mental health system is a bit of a mess. If you go to hospital, like a public hospital, for a psychotic episode, or if you have actually harmed yourself or whatever, then going to a public hospital, they will see you and maybe you'll even get admitted. But if you just have, you know, really morbid thoughts about not existing anymore, what I've heard is they will just sort of keep you waiting in the emergency room for like hours, and then eventually when they see you, they'll pat you on the back and send you on your way, sometimes without even referring you to other supports. So why would you go to a public hospital for that? Most people who go to hospital for less serious conditions will go to a private hospital, which costs a ridiculous amount, unless you use like the private health insurance loophole to get like top level cover and then get yourself admitted that way. But what they basically do, because I looked into it for myself, is they will admit you for about 3 weeks. You're trapped in this place and mostly doing group therapy, which sounds like shit, and it's not going to help, and it's not going to change my situation when I come home, so I've never done that. Otherwise, like psychiatry, I don't remember how much it gets covered because I keep going over what's called the Medicare safety net. So when out of pocket I have spent a certain amount of money, then the government covers 85% instead of whatever the lower level fee was. So that happened quite a lot, and I can't remember how much psychiatry actually costs. But my psychiatrist the last psychiatrist I saw was kind of useless because he'd only see me for half an hour, and he was treating me as if I was on medication when I wasn't. So instead of seeing me every week or 2 weeks, he would only see me every 6 weeks to 2 months. Which is like how long you need to see if medication is going well. But if I wasn't on medication, why have that huge gap between appointments? I don't know. He had no logic there, and didn't really listen to me or understand me, so I stopped seeing him. And because I'm not taking medications, it doesn't make sense to go the medical route. So what am I stuck with? I'm stuck with psychology. I do see a clinical psychologist, which I think is like the highest level of psychologist you can see. Below that is registered psychologist. Below that is just counselors, which I don't think are covered by Medicare. And yeah, like basically for the Australian mental health system, if you have easy problems like low-level depression, anxiety, stress, relationship problems, whatever, then you see the talk therapy people. If you have extreme schizophrenia or actually hurting yourself, you go to hospital. Eating disorders, you go to hospital. But if you're in the middle with complex issues, no one knows what to do with you, especially if you can't take medication. And I know there's like the brain magnets thing, but that takes a certain commitment, which would require me to leave the house every day for a couple months, which I cannot do. It's enough to just walk my dog locally rather than go all the way somewhere for some treatment every damn day, and there's no guarantee it would work. And then if you need repeat treatment, Medicare doesn't cover that, so fun. It only covers like twice, and then after that, if you need more treatments, it's expensive, and you're back to square one. With psychology, so there's a brief overview of the Australian mental health system and Medicare. Okay, getting to the relevant stuff. With psychology sessions, unlike psychiatry, there is a limit to how many psychology sessions Medicare will cover. At present, it's 10 sessions, and instead of covering the full psychology fee, it only covers, I don't know how much it covers now, but I think it was like, for a clinical psychologist, maybe like 140-ish. A registered psychologist, I think, I don't know, maybe it covers only 90. It's probably changed now. I don't remember because most recently I passed the threshold, the Medicare threshold again, so they were paying 80 to 85% of my fee, so I can't remember. how much the actual psychology rebate is. But after 10 sessions, you're on your own. And that's annoying because, like, I just passed the threshold and then maybe claimed 1 or 2 sessions at the 80 to 85% rate, and then now I have to pay the entire fee all of a sudden. Like, there's nothing. During COVID, the Liberal Party, who are our Conservative Party in Australia, because we do everything upside down here in case any Americans are confused, the Liberals are our Conservatives. They increased the number of sessions you could get to 20, which was helpful. That was like one of the better things they have done. But then Labour got in, who are our left of centre party, and they got rid of it. And when the Bondi guy, the schizophrenic Bondi guy, went around with his knife, after that, there was a lot of talk about we've got to do more for mental health in this country. And they did nothing for people like me in that missing middle. And this article comes out. So Australian psychologists call for 40 rebated sessions for victim survivors of childhood trauma. I'm sorry, I'm looking in the wrong direction as far as the screen goes. That's just... Maybe I should have put the article on the other side. I don't know. This isn't mirrored, so yeah. Yeah, with this article, it annoyed me. This was on Friday. I will put a link in the description, I guess, if you want to read the whole thing. What annoyed me about it is not that psychologists are calling for 40 rebated sessions. Like, that makes sense. Can you imagine? So I'm seeing a psychologist every 2 weeks. Ideally, I should probably go every week. But my current psychologist costs $200 every time I go. And I have run out of sessions, so I have to pay that myself. I do get government payments. It's not a lot. And that's why I can only go once every 2 weeks instead of every week. And this is after I changed from the previous psychologist I was seeing, whose rate this year jumped up to $280 a session. So, but I like my current psychologist better. I had been seeing her before, but then she had to go and get surgery. She left the clinic that I was at, and it's only like this year that I realized she was back in practice and, managed to track her down and found she had places available and got back in, and left this clinic, this expensive clinic, with that psychologist. I mean, she tried, but I think she had run out of ideas with me, and I never felt like she was trying that hard. My current psychologist, the $200 one, she actually reads my diaries, and my videos go on forever. My writing is the same. And she actually, is trying to work with me and isn't, she doesn't avoid the topic of dissociation, which some of them do. And I like her better. Anyway, and she knowing my financial situation, she made some concessions so that I can get it cheaper, because she's working for herself now instead of for the clinic, so she can decide that. And even at the clinic, she gave me $5 off, but now it's significantly less. She usually charges $230, I think. Anyway, so because I have to pay $200 myself every time I go, I can only go every 2 weeks. Which, that means I get 2 weeks worth of shit to talk about every time, or in my diary. And if I'm having a crisis, I have to wait to get that in-person support. Anyway, so when we talk about the 40 rebated sessions, can you imagine? So 10 sessions in a year we're talking about. 10 sessions in a year. If you're someone who needs long-term support from a psychologist and you couldn't afford to pay them completely out of pocket, then maybe you could only go once a month. And you wouldn't even get to the end of the year, not quite. So when the 20 sessions came in, then you could go every 2 weeks. And then they took that away again, and you're like, well, if you only have a short episode of depression, and it's your first ever episode of depression, and you're actually not that bad, you don't have a chemical issue where you need medication, you don't have serious trauma, complex issues, whatever, 10 sessions might be enough to help you get through that brief period of depression or whatever it is. But yeah, if you have something very complicated and you need to see the same person every time so that you don't have to retell your story every time, yeah. Anyway, so I think you're getting the idea is like 10 sessions is not enough, and it's designed for that low end of the mental health scale. And for us in the missing middle, like these guys asking for 40, they're sort of saying like 40 sessions, you could keep going through most of the year, like almost weekly. It's not quite weekly, but then psychologists do sometimes, like, they tend to take a break over like Christmas and a few other times, so we get you through most of it. It's still much better than 10. But they have said in this article, victims of complex childhood trauma. And for the most part, when people think of complex childhood trauma, they tend to think of, you know, sexual traumas and stuff, and or like violence. And I don't know if they would recognize glass child trauma. So that's one thing that annoyed me a little bit. But what really annoys me, and like, see, some psychologists say their clients are rationing their 10 sessions throughout the year so they last as long as possible. But this is what pissed me off. What's next? Federal Health Minister Mark Butler says additional sessions for people with complex needs are not the solution, and his department has instead funded 61 free walk-in mental health clinics. I have looked up these clinics, and they do not offer long-term support. They do like crisis support, and they help you find support, and maybe they will give you some short-term therapy. But again, that's only for people who are like, maybe this is the first time they've ever had mental illness. And, I mean, long-term support, I have found a psychologist. I've finally, like, after so many years, found a psychologist I feel comfortable with, who I don't feel is bullshitting me or gaslighting me or treating me like an idiot. They would, the whole point of these fucking clinics is to help you find that psychologist, but then they don't help you pay for it. And, you know, when Labour, our left of centre party, when they cut the sessions from 20 back down to 10, they were saying shit. Excuse me, sorry. It's just frustrating and hard to get my thoughts together when I start being like, there are so many things, where do I even start? But like what would you propose for, like, he's saying people with complex needs are not the solution, and they funded these free walk-in mental health clinics. Walk-in means no appointment, so you don't know who you're going to see. This isn't for complex needs. What are you talking about, mate? I can't even. Where is the logic? Like, this is typical politician speak, not understanding the problem and trying to bullshit people into thinking that anything has been done. And then, so, blah, blah, blah. This is talking about this chick, like, she has complex needs, and she has to see a psychologist twice a week. And uses up everything, like, you know, she's even doing this extra GP rebate thing for 5 sessions, and then private health for 6 sessions, and she uses it all up in about 2 months. And then you've got to go and pay for everything by yourself. And these GP ones don't cover anywhere near as much, and neither does private health insurance, although it would depend on what level of cover you have. It's just like, she's spending $20,000 a year. Oh my god. Now, with this saying 40 sessions for childhood victims, again, I don't know what they think counts, and I don't know if they would realize that I have complex needs and I didn't have violence or whatever. But what kind of annoys me about that is that there's any arbitrary limit at all, because, like, how can a faceless government just say, oh, you only need 10 sessions to get better? They don't know you. They don't know your situation. They don't know what's going on. It's random, and it's a one-size-fits-all, and there is this missing middle of treatment. I cannot take medications. I can't go and get the brain magnets. I'm not suitable for hospital. What do you want me to do? You should, like, you know, if this is their attitude, they should legalize euthanasia for psychiatric conditions, because otherwise you're just kind of giving me not great ideas about how I would get a solution. Like, it's just, this is dumb stuff. Look, there's no research to support limiting the number of sessions to 10. It's completely arbitrary. It doesn't make sense. Not the solution. Get lost. Get lost, mate. Blah, 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 blah. Look, I can't remember who Mr. Carrison... I don't know about you guys, but when I read these news... Oh, Miss Carrison. When I read these news articles, I can never remember who is who. So, the association... Which association? Tegan Carrison. Which association? The Australian Association of Psychologists Incorporated. Yeah, I forget who people are talking about. Anyway, never mind. Because they're just names. I don't care who they are, really. Miss Carrison said the decision on how many sessions were appropriate for individuals should be left up to a treating doctor and not the government. Exactly, yes. My goodness, like, the government doesn't know me. They don't know my situation. Like, fuck off, mate. Fucking elbow. Look, despite calls from politicians and emergency services for 20 to remain. Like, 20 wasn't perfect, but it was better than 10. Oh. So, this was the main excuse for getting rid of the extra 10, is it squeezed the supply of mental health workers and prevented those in lower socioeconomic and regional areas from accessing care. Okay, a couple things. The reason the supply of mental health workers is being squeezed is because we don't have enough of them. We haven't prioritized psychiatry, psychology in this country. We're not like America that has a real therapy culture. Like, you know, if you look at a lot of American TV shows, a lot of them will go to therapists and they talk about their shrink and all this kind of stuff. In Australia, it's taken us a lot longer to get on top of, like, mental health awareness, mental health acceptance. There's a bit of that, like, outback bush attitude, of, like, toughing it out, you know, that sort of blokey, matey kind of thing. I think that's probably a big part of why we don't have that in this country so well. Because we tend to think of how tough we are as Aussies with our drop bears and all the creatures that are trying to kill us and, you know, the climate trying to kill us with floods and, you know, the bushfires and everything. So we're trying to be heaps tough, but yeah, no. The problem is we haven't trained enough of these people. There aren't enough training spots. Like, when I first got out of school, I remember the mark to get into psychology at one of the top unis. Like, I'm sure, like, at the lower, you could get into psychology at a less prestigious university for less. But at, like, Sydney University, which is considered to be a big deal, it was like 97 UAI to get in. and like, that's based on demand. Oh my god, there's a little bit of a delay in the OBS. Maybe I need to fix that again. It's just distracting watching myself now. I'll try not to look at myself. But so the way that the university entry scores work is based on demand. So they have a certain number of places and they take the top students who apply for it, and then the cutoff is like the lowest score someone got that got let into the course. So it's not like a measure of how difficult a course is or anything. It's just a demand. And that tells you when I mean, this is, oh my god, how old am I? This is maybe like more than 15 years ago. Because I am that old. At least back then, they just didn't have enough places in the psychology course. And so that's why the entry mark was so high. I don't know if that's changed because I have no interest in what the score is anymore. But, like, fund more places. Fund more places for people to study psychology. Our university system is a bit weird as well. Yeah, that's what we need, is to train more people. So, you know, that's one thing about supply. The other thing is those in lower socioeconomic and regional areas from accessing care. One, fewer health professionals in those areas, and then high out-of-pocket costs. Like, do you think that taking it back to 10 sessions, that people in lower socioeconomic categories that suddenly they're going to be able to afford psychology when the psychology Medicare thing doesn't even cover the full fee. In some cases might only cover half the fee depending on how expensive the psychologist is. And then after 10 sessions, what are people in lower socioeconomic existences going to do if they need ongoing care? They're not going to suddenly have more money just because you limited everyone else from having extra sessions. Like, there's no logic to that. What the heck? Yeah, I'm becoming inarticulate because it just doesn't make sense. You need to put in incentives to train more people in these fields, and you need to cover more of the fee, then they'll be able to afford it. And then for those of us who have ongoing conditions, we'd be able to afford it and maybe use money for other things. Like, if you're spending money trying to see a psychologist, you can't spend it on things that might help you recover in other ways. I've heard of, this is just a problem with welfare in general, because, our welfare payments have been sluggish for decades. They put a cap on it or something, and then, it's, way below the poverty line now because of it. I'm talking about the standard job seeker. I'm getting myself confused. But, so people who are living on that poverty line, on really low-level government support, being constantly harassed by Centrelink to do a bunch of fruitless job search and other stupid activities that generally don't get people actual jobs. It just wastes their time, so then they have less time to actually find regular, decent jobs, but then they also can't afford work clothes to go to interviews and be presentable, and they can't afford to eat properly, so their mind doesn't work well enough to be able to pass those interviews and do the jobs because they're constantly nutritionally deprived. There's just this whole bunch of dumb stuff that makes things worse for people. And during the pandemic, I'm pretty sure, I haven't double checked it because it's a while since I looked it up, but I'm pretty sure I remember hearing that the suicide rate actually went down. And I think part of that is because there were these huge government support systems in place. The basic welfare payment, I think, doubled, and then people who had jobs but couldn't go to work because of the pandemic had a decent amount of money coming in as well. And a lot of businesses were able to, it came through the businesses to pay them, and so they were able to survive. And people were just less stressed because they didn't have financial stress. One of the things that causes even people without mental illness to want to off themselves is severe financial distress. That kills people, basically. But, governments haven't figured that out. Now I get it. You can't just print money and blah blah inflation, which is the problem we're seeing now. Although inflation isn't just because people have more money that they saved away, it's also because there were production issues in China, and there's problems with trade, so then there's less product, which means supply and demand, and it had some things with demand, the demand was the same but the supply was less, and that's how prices go up. And the Reserve Bank just increasing interest rates isn't going to fix it. Fucking economists. Oh, they do my head in as well. Anyway, this is a shit excuse. And also, they didn't actually say to take away the extra 10 sessions. They just said it should be targeted to those with more complex mental health needs. Yeah. I can't even. I can only odd at this point. Look, on-call psychologists and psychiatrists, which means you don't know who you're going to see, and you're going to have to tell them your whole fucking story every time you go in, unless you get lucky or get, a short-term number of revisits. But then long-term, I looked it up, and long-term they do try and flog you off to someone else, and then it's not free anymore, and you still have these problems. Oh my god. yeah, so you cannot see a psychologist for $150. Oh my god. And look here, bulk billing incentives and rural and remote loadings for psychologists. So basically paying psychologists more to go to remote areas. That would make more sense. Give people incentive to go into mental health as a profession and to go to the middle of nowhere to offer services there instead of just staying in the big cities where people tend to have more money. That's how you fix this. It's not to blanket punish everyone because a handful of people can't access it. Like, just because people out in the bush can't get as much service, now none of us can get service. It's just... And look, lean on her family to continue her sessions. That's basically what I'm doing. On call rather than at the centers. What does that even mean? Like, you go and someone has to come in to see you? I just... And then, yeah, with the whole, like, victim survivors. I don't think it should depend on your trauma or whatever. I think it should depend on what your mental illness is and how complex it is, how much you actually need. It shouldn't be just because you have the right mental illness. Like, with eating disorders, I think this is still the case. You get 40 sessions, because eating disorders are very difficult. People, like, I think you are at the highest risk of death if you have at least certain eating disorders, and very hard to treat. So I think they get at least 40 sessions a year. But if you have the wrong mental illness that's just as complex, maybe not as immediately threatening, but does need a lot of work, otherwise you will die. No, if you have the wrong diagnosis, you are not entitled to the sessions that you need, and it just doesn't fucking make sense. Anyway, that is my rant for today. I'm sorry it's disjointed. I'm too tired to, like, properly structure my videos, and I get distracted, and I can't remember what I was going to say, but you can see he's popped out there. He's a little bit tired. I don't know how much time I have left. Anyway, I just think mental health care in this country is a joke. Funnily enough, the Conservatives, the Liberal Party, actually did better with it for a change, which, like, the way they handled the pandemic was actually pretty good and a lot better than I expected. And but, you know, then of course they fell on their faces immediately after. And then the left of centre party just dropped us all, and they're all talk when it comes to mental illnesses, complicated mental illnesses, severe mental illnesses. It's all bullshit. And thanks, Albo. And what's this guy? Mark Butler. You guys can get fucked. There isn't an election for... Oh my god, I just I fiddled and something is broken. Anyway, oh, that was a big stretch. I should just end the video and move on, but I'll link the article if anyone wants to read it. Mental health care in this country is a joke, and if you have the wrong mental illness, you are on your own. Also, I should mention, as a schizoid, I've said in previous videos, I was rejected from care because no one had the confidence to be able to work with me. What are you going to do about that? That's a different situation to these people living in the middle of nowhere not being able to access care. What are you going to do for those of us where, you know, no one has expertise in our conditions, and to get someone to agree to see me took quite a while, and I think I had to weasel my way into the clinic because, you know, my GP referred me there, but then when I called up, they said they had no places, but then I saw on their website that they were advertising they had places available, and I said, hey, you advertised this, you shouldn't be getting people's hopes up, especially when they have mental illness, and then they decided they would see me. Like, that's how I got back into the psychology system, having quit after seeing the hypnosis chick who was absolutely terrible. And she didn't even do hypnosis on me. She would just talk about it all the time. And I'm like, what the fuck? Anyway, yeah, no, sometimes they will just refuse to see you because they don't think they can handle your condition because your condition is so unusual and people with your condition tend not to come forward for treatment. What are you supposed to do then, huh? Mark Butler? Fuck off, mate.